Hi, everyone. I'm Heather Carter,
And I'm Dr. Shad.
and we are back with Conversations That Matter. And we find ourselves at the beginning of June, and we thought it would be really important to give you an update on where we are at in terms of the COVID-19 pandemic. So, as you know, Dr. Shad, there's lots of research that has been released over the last week to 10 days, providing some new insights related to COVID-19. And there's new information about testing, and we have different testing protocols that we're putting in place around the country. So, without any further ado, if you don't mind, I'd like to jump right in on something that I saw in the literature.
Let's do
Um,
it.
Talking about the the disease as being not just a respiratory disease, but a vascular disease. Um, we've talked a lot about our diet and how that affects our health. And when we eat a plant-based diet, we are able to prevent, for example, heart disease, prevent and reverse heart disease. And this article really talked about inflammation throughout the body. And I was wondering if you could give us a medical perspective on what that means. What does it mean to be perhaps a vascular disease and not just a respiratory disease?
Yeah, that's a great question. I think that what we see here in terms of coronavirus is we keep learning about what causes it, how is it formed. Initially, we thought it was like, the cold or flu transmitted like any other coronavirus, which is usually a respiratory, and we do see the transmission, and there is definitely a strong respiratory component. But you're referring to an article that was published in JAMA in the last week or so, talking about how coronavirus may actually be a vascular disease as an underlying pathology. So what that means, vascular is basically a fancy medical word for your blood vessels, okay? And your blood vessels over time basically develop, they become hardened, and they become more resistant, and you get higher blood pressure. This happens a lot earlier in life if you have a sedentary lifestyle, if you're not exercising adequately, because exercise keeps your blood vessels elastic and strong, and keeps them from hardening. The other thing is the food that we eat. So if you're eating the standard American diet, which we talked about last time, which is sad, it's basically full of processed foods and things that cause inflammation in your blood vessels. So for example, hydrogenated oils in foods that are added to increase shelf life. When you ingest those foods, they oxidize your LDL, which is your bad cholesterol, and begin the cascade of atherosclerosis, which is basically the process of inflammation that ultimately leads to a heart attack or stroke. They're finding that folks with the worst outcomes with coronavirus, right? So we're seeing that a lot of people are infected with coronavirus and have no symptoms or mild symptoms. But then there's some, right, a small percentage, and we're not sure exactly what that is going to end up being because it's different around the world, and because we don't have testing for every single person to be able to see what's going on. That's where the testing comes in. But what we're learning is that those who have chronic diseases, particular vascular diseases like high blood pressure or diseases that increase your cardiovascular, right, risk of, like, for example, cardiac risk equivalent is diabetes or obesity. These all promote inflammation. They're pro-inflammatory diseases in the body. And these folks who have uncontrolled conditions, right, these chronic conditions, they're at greater risk for getting sicker when they get infected. So they're the ones who get hospitalized. They're the ones who require oxygen. They're the ones who may need a ventilator at some point. And then sadly, they're one of the folks who ends up dying, right? And so a big percentage, right? So there's obviously some people out there also. So we're still trying to understand, what is it, right? So does it mean if you don't have high blood pressure and you're not obese and you're not over 65 that you have no risk for anything bad happening to you with coronavirus? No, the answer is no, because there's other factors. So another thing that's come up in the research recently is vitamin D deficiency. There was a study in Europe that basically looked at vitamin D status and found that those with a vitamin D less than 30 which is vitamin D deficiency. That's the number that we have also for our cutoff point standard labs here in the US. We're at increased risk for hospitalization and requiring oxygen, looking independently just at their vitamin D status. And so that would be someone, for example, where that could help explain, right? Because we're all asking these questions to help explain what's going on. Scientists and doctors, we have the same questions as everybody else, right? But we have our scientific tools to kind of ask these questions in the laboratory and in the clinic. So, that's one of the answers potentially, right, that we're getting is maybe vitamin D. So maybe someone who is seemingly healthy, right, and young, and has no chronic diseases, they're not obese, they don't have high blood pressure, they don't have diabetes, they might be vitamin D deficient. That may be the thing that is the reason why they got sick and were hospitalized and on a ventilator, in some cases died. We don't know yet, right, because we're still getting the data, but these are some of the things that we're learning. Another study recently showed that people with, in a subgroup of people that were studied, that people with type A positive blood were 50% more likely to be hospitalized or require oxygen. Of those infected, right? And so we got to take all these with a grain of salt, but because it may not be universal, but it's starting to add the pieces of the puzzle. And I'm glad that we're doing this at the beginning of the month. And I think we're going to plan on doing this at the beginning of every month as a status check to see where are we at with the science, what do we know, and where are we at in terms of Arizona with reopening and testing. Specifically, like what testing options do we have? What availability do we have? What does that look like? And I think those go hand in hand. So we learn what the risk factors are and we try to address them as we're learning about them, right? Vitamin D deficiency, by the way, is something that many people think. I was being interviewed for a news station a week or so ago, and they said, well, if that's the case, then, we should be good in Arizona. And I said, no, actually, we actually have a pretty high percentage of our population, the majority, who are vitamin D deficient. And that's because we spend a lot of time indoors and it has a lot of other factors that are involved, right? And so a lot of times people do actually need to supplement. Now, vitamin D is one of those supplements where you don't want to just do it on your own without getting tested for your vitamin D level, because it's a fat-soluble vitamin. And so if you take too much of it, it can actually do more harm than good and can be toxic.
Oh, that's good.
So it's different than, for example, a B vitamin, which is water soluble and you can take, and it has very little risk for harm because it's water soluble, and anything extra you just excrete out. But vitamin D.
The recommendation is not to take a vitamin D supplement just because this new research.
Right. I wouldn't just jump to. I would talk to your doctor and get a lab test for vitamin D to see what your vitamin D status is.
Well, and in Arizona, what's really interesting is a few years ago, I ran a bill that allows you to do direct lab testing. And funny, you mentioned vitamin D. We had direct lab testing available prior to this piece of legislation, but vitamin levels was not one of the labs that were permitted. So this is something that you can work in concert with your primary care doctor and go and get a lab very easy and sort of track within some sort of a healthcare delivery system.
And I actually think that is on the list. I have some patients, because of insurance reasons, they do order their own labs. And actually vitamin D is one of those you can pay for.
Only new. So prior to the bill, it was not on the list. We use that.
So that's look at policy making an impact on what we can.
Right, because prior to that, you couldn't do a vitamin deficiency test. You couldn't do a pregnancy test by a blood draw. We had to pass legislation to allow that to happen. So this is sort of some of the work that I've done as a state senator coming full circle and being available now during this period of time. So long story short, though, just as we saw with other medications, the goal isn't to go out and start taking vitamin D supplements, but it's to be aware that this could be a factor as well.
Yeah, if you're going to take a vitamin D, I would go the lowest dose, which is 1,000 IU daily, and that's, minimally, again, but even in that case, depending on what other supplements you took, depending on what medical conditions you have, it's always better for something like vitamin D to get your blood level tested. And then you start a supplement based on advice from your doctor, and then you recheck again in 4 to 6 weeks to see where the level's at. But again, that's one of the many factors for the coronavirus that we're learning about. There's also going to be genetic factors where some people have genetic predispositions. We still really don't know much about that, but we're learning. So I think that as we're learning these things, again, people with chronic disease, as we talked about, there's a very strong connection between chronic disease and getting sicker from a coronavirus infection, right? And
And
being
then,
at high
and
risk.
then I've got my kitty cat going back and forth here.
Yeah, it's
And
great.
it's not just about a respiratory disease. It could be other body systems that are engaged. And the article was also referencing this could be part of what we're seeing in young kids that are coming, are presenting with, give me the name. Is it, give me the name that they're presenting with, Kawasaki?
Kawasaki's. Yeah.
Like conditions, and they're saying
Correct.
that could be related to the vascular system. And on that same note, this is what sort of the news media then started to report, is that we're looking for some sort of a treatment. So we talked about testing, which we're going to talk about in a minute, but treatment now, because we have identified another body system, there could be existing medication on the market that would treat high blood pressure, for example, that could help mitigate some of the most dire outcomes of COVID-19.
Right. There's no question that the new article, because they also talked about how some of the brain impact in
That's
terms
right.
of like stroke, as
Right.
well as like some of the cognitive dysfunction and things associated with some people like after the virus, like several months, weeks and months later, again, being related to blood flow to the brain. So there's no question that treating your blood pressure, if you have hypertension, if you've ever been told you have high blood pressure, I have a lot of patients who I see who know that they may have had a high blood pressure reading at some point, but they never
Right.
bothered to check it, or they've been told they have high blood pressure, but they don't have a monitor. It's not that expensive to get a monitor to check at
Right.
home. Some of them are as low as like $40, right? You can get,
Right.
and you want to check your blood pressure multiple times throughout the week to be able to get an accurate reading. But yeah, treating things like your blood pressure and optimizing your weight, all of these things, treating your diabetes, and a lot of these things, it's not just medication, as we like to talk about, and we'll talk more about. It's also what you eat and
Right.
how you live in terms of how active you are. That makes a huge, huge impact.
And really, if you're staying at home and you're making healthy food choices, you can see a turnaround in some of your numbers in a very short period of time. But the converse is true as well. If you're eating at home and you're just consuming more junk, your numbers can skyrocket in a very short period of time when it comes to cholesterol and maybe even and blood pressure. And then whether or not you decide to get out of the house and exercise, move, or even do a home exercise program or something like that.
Absolutely. Yeah, it makes a big difference.
So the next, we sort of addressed the issue related to testing, and we're headed into the beginning of June. We just came off of a holiday weekend, and there are a large number of people congregating, and what we're seeing is an increase in the numbers in Arizona. So we can talk about that in another episode, but I really wanted to focus on specifically the rollout of testing in Arizona and where we are at now in June. So the University of Arizona is engaged in a partnership with the Department of Health Services for the state to test all of our first responders, our healthcare workers. And it was actually originally launched for just those that have a license. So if you were working in a long-term care facility and you were a licensed RN, you could get tested, but not the medical assistants. And now they've expanded it to include, for example, DCS workers and other non-licensed worker on the front line. So the good news is there's a lot of new antibody testing that has come online for the citizens of Arizona, but there's also a lot of private labs that are offering antibody testing. Some are by a blood draw, some are by a drop of blood. I've heard there are oral swabs.
Yeah.
And this is very different than the PCR test, which is when you have an active case of COVID. So could you just, in very short, because I know we're running close to time here, describe the difference between the two tests and then take a little deeper dive over on the antibody testing.
Yeah, so first in terms of the tests that are done for the infection, so there's two types of tests. You're referring to the testing for the infection versus the antibody test, right? So one is you could actually test. So it was initial test that we started doing, which just to see if you have the infection.
Right.
This is the one where you've heard of folks testing multiple times, like almost every day, if you have availability in certain settings in the government and other settings where people have to be in close contact, right?
Right.
Because you could be positive one, negative one day and then positive the next day. And so that is one to test for the infection. And as you said, we've had statewide blitzes in terms of testing. We have a number of clinics that offer that now. Initially, it was limited to folks who had a certain constellation of symptoms, but
Right.
now anybody, even if they feel like they were in contact potentially with someone who may have had the coronavirus, then they are able to get this test.
Right.
And so that's one really I would say to do if you think that you have been exposed or if
Mhm.
you think you are sick with it. Again, so, and a lot of times people, like I said, a lot of folks will just get no symptoms or very mild symptoms.
Mhm.
Um, the thing about it that's important as we're improving our testing for the infection is shortening the time to when we do the test to when you get the results, you
That's
know?
true.
And that's one of the challenges, right? So for example, we talk about things like the flu, and you have the rapid flu test, which is literally a matter of minutes in your doctor's office. We're not there yet with the coronavirus.
Right.
If we were, it would be much better, because the key to testing is not only so that but you to protect yourself, to do whatever you're gonna do, but it's really to protect others, to isolate if
Right.
you need to isolate, right?
Right.
So I would say if you have been exposed or you think you got it or you think you're sick, obviously consult your doctor, consider getting tested. But the other thing you should do is self isolate.
Right.
Put yourself in a 2-week quarantine, because 2 weeks is about what it takes to see whether or not it kind of builds out. The other thing is, even if you have no symptoms, the research has shown that you can go through and be infected and never have a symptom, but anybody you come into contact with will get infected and they may or may not get sick. That's what the challenge is when younger folks go and congregate together and then they go home to mom and dad or grandma and grandpa get sick even though they never got sick, because they can get it and then they can give it without ever having a sniffle.
Right.
So that's important.
And then that's different than the antibody test as well.
The antibody test is our attempt to try to understand who is immune to it and who's not immune to it. The University of Arizona, as you said, has embarked on a kind of historic venture to do antibody testing for a number of people. They started, as you said, and they expanded beyond healthcare workers
Right.
to first responders, and they're going to be offering it to the students and the faculty, like you and I, or
Right.
both faculty, right? At some point to help determine when we can reopen and return. They've got great expertise there helping with it. Dr. Richard Carmona, I think, is on point, former
Mhm.
Surgeon General. So we've got a lot of different things going on with that. But the antibody test really checks with whether or not we are immune. We don't really know 100% if it's how valuable it's going to be yet, because there's not a high percentage of people in the community that necessarily have it. So that also affects how effective an antibody test is.
Mhm.
So we're learning and we're going to see how well it does. It's definitely much better than nothing because it
Right.
gives us a step in the right direction, but it's to see whether or not if you have the antibody, it means that you were infected and your body responded. Your immune
Right.
system responded to it and it fought it off, and now you have some kind of immunity or protection against the virus.
And then some of the tests have different levels of sensitivity too. So if you're going to a private lab,
Yeah,
you really want to talk to the person or the office about what the level of sensitivity is of that test, because
correct.
depending on the level of sensitivity, you may have a false negative but be positive, or vice versa.
So for a screening test, you want to have a high sensitivity
Mm-hmm.
because you want to be able to not get false negatives,
Right.
right? Because you want to be able to detect it if it's there. For a confirmational test, you want to have high specificity. Ideally, you have both.
Right.
And nowadays, the tests that we have are suffering because they don't from both, not being as sensitive or specific. And I think you pointed that out. A good thing for people to know is when they go and they're going to ask to get tested,
Right.
you can ask, what is your false positive and false negative rate? How
Right.
does it compare to other tests that are out there for the coronavirus? So there's some that are better than others, that's for sure.
So I think this is a lot of information, but these are
Yeah,
why conversations that matter provide information to our viewers, because when we're trying to cut through all of the noise that exists on your local TV stations, through social media, through email blasts, and so forth, it's so hard to digest it into something and synthesize it while you're trying to work and take care of your families and so forth. So that's why these conversations really matter, to kind of cut through that noise. And so I think we covered a lot of information today about what some of the new literature is demonstrating about what this disease is, and perhaps new treatments that we could take or undertake to mitigate some of the worst outcome of the disease, and then also what is happening in Arizona around the process of testing. And the good news is I'm hearing from people that I represent and friends and families and neighbors that if anybody wants a test, they're able to get a test. There's the testing is available now in a way that it wasn't available even as short as a month ago. So there's been a
sure.
real improvement on the availability of both kinds of tests. Now it's about collecting that information, and really these conversations are, we're trying to focus on what can you do as an individual. So I think our takeaway, if you don't mind, like as a doctor, what are the individual takeaways? Eating properly and staying at home. I mean, what do you say if it was a patient you were talking to?
Yeah, I would say, we're not completely past this pandemic, so keep safe. Um, stay at home if you have one of these chronic conditions,
Right.
like diabetes, heart disease, high blood pressure, obesity. Potentially check your vitamin D level if you haven't checked that. If you were waiting for a time to get physically active or be healthier, because you know
Now's
what
the
it is to
time.
be healthy, now's the time to do it. Because ironically, staying at home, people have become couch potatoes and binging on all sorts of unhealthy foods actually puts you at greater risk for having poor outcomes with coronavirus if you get infected. So this is the time to really take the health matters into your own hands. And then if you feel like you have symptoms or you've been exposed, isolate yourself, get tested. If you're going to be out there with work and you're going to be exposed to more people, consider getting the antibody tests to see if you have some kind of immunity to it. And just stay tuned for more, because
And
you never know
enjoy.
what's going to pass you, and your cat coming by and
I
then
know, and enjoy your pets while you were at home. But
yes,
really, I think that is such great advice that um, we started these conversations that during the onset of our public health crisis, and it's so important to at the beginning of each month to have these updates, because things are changing rapidly. So our conversations that we started towards the end of April, beginning of May, are very different from the conversation we're having now at the beginning of June. And I predict we'll find some new information out by the start of July as well. So we'll pick up with our regularly scheduled topics around making healthy food choices and lifestyle choices in our next conversation. But for now, I really wanted to focus on what's happening at the beginning of June, and then just stay tuned for an update at the beginning of July as well.
yes, sounds great to me.
Okay, well, thanks everyone for tuning in. And as always, please subscribe to our channels. You can follow me on Instagram. It's Health with Carter. And Dr. Shad, what is your Instagram?
Yeah, it's Dr. Shad 9. Facebook is Dr. Shad, and my website is also drshad.com. And so we'll have links to all that stuff. I'm going to be putting all these things on YouTube as well, so people can access it. And please, I welcome people to message me, message you with any
Yes.
questions that you have. If you're diabetic and you're wondering, how can you minimize your risk if you have high blood pressure,
Right.
any of these types of questions, medical questions, public health, public policy. We want your questions so that we can make these conversations matter for you and your family.
Perfect way to end today's conversation. Thank you so much for joining today.
Thank you.